Okay, I'm here to present to you a small research study on thyroid cancer patients. Can you hear me, Dr. Zahir?
Yes, you're audible. Please carry on.
Okay. The title of my talk is comparing high and low dose iodine 131 ablation therapy in intermediate and low risk DTC patients. Differentiated thyroid cancer is the most frequent endocrine malignancy, and its incidence is 40 cases per million per year in the United States. Papillary thyroid carcinoma accounts for 80 to 85%, and follicular thyroid cancer 10 to 15% of thyroid malignancies. 10-year survival rate in case of distant metastasis is 25 to 40%. DTC treatment includes surgery followed by radioactive iodine therapy, and the purpose for radioactive iodine therapy is to ablate residual thyroid tissue or as an adjuvant therapy to microscopic iodine 131 AVID disease, or to provide a post-treatment whole body scan. Now, depending upon the clinical, biochemical, and histopathological features, the patients of DTC are divided into low, intermediate, and high-risk groups. The clinical trial under discussion, it focuses on intermediate and low-risk patients. The objective was to compare the effectiveness of low-dose iodine 131 ablative therapy against high-dose radioactive iodine therapy in intermediate and low-risk DTC patients. It was a controlled randomized study of 93 patients with age ranging from 15 to 60 years, and this was prospectively conducted from 2016 to 2019. These were divided. These patients were divided into Group 1 and Group 2. Group 1, those patients who underwent high-dose ablation. Patients who underwent high-dose ablation that was 3,700 megabecquerels or more than that. Group 2 were the patients who were ablated with low dose, that is 1110 megabecquerels or less than that. Findings of whole body iodine 131 scan, radiological imaging of neck, serum thyroglobulin and anti-thyroglobulin antibody levels were recorded at the time of presentation and at the intervals of 6 months, 1 year, and 2 years. Spearman correlation coefficient was calculated to establish the correlation between the two groups. The risk stratification was basically depends on the ATA guidelines, the previously known ATA guidelines, and the patients were divided into intermediate and low risk groups depending upon these clinical features. We set definitive disease-free criteria for the patients by utilizing critical tools, which were basically the response indicators in our study. And these were iodine 131 whole body scan, ultrasound neck, and stimulated serum thyroglobulin levels. If a patient had any one of these response indicators positive, the patient was categorized as disease positive. And the patients were labeled as disease negative if all of the 3 response indicators were negative. Coming on to the results, total 50 patients were included in Group 1, 43 in Group 2. Mean age was comparable. There is gender classification. And then we can see that both the groups were predominantly populated by the papillary thyroid carcinoma patients, and 3 follicular cancer patients, the thyroid cancer patients were included in Group 1, 1 patient in Group 2. Intermediate risk patients were 31 in Group 1 and 26 in Group 2, and similarly 19 low-risk patients were included in Group 1 and 17 in Group 2. Here is the tabulated form of the percentage of the patients who had normal response indicators from a high-dose group, and these patients were intermediate and low-risk patients. And the response indicators were calculated or recorded at the 6 months interval, at 1 year, and at the end of 2 years. Here we can see that the maximum percentage of the patients, that was 86%, they had ultrasound neck normal at the end of 2 years. And similarly, in the other case, that is the low-risk patients, the same was the percentage, and these patients had ultrasound neck normal at the end of 2 years. This is the tabulated form of the percentage of the patients who had normal response indicators in low dose group, and again intermediate and low risk patients are here. And we can see the response indicators at the end of 6 months, 1 year, and finally at the end of 2 years. Here again, the percentage of the patients who had normal response indicators, the maximum percentage were the patients who had normal ultrasound neck at the end of 2 years in both the groups, the intermediate and the low risk. This is a picture of ultrasound neck of a patient pre-ablation The patient picture is here, and it shows the small nodules in the right lobe, and this patient had residual disease before ablation. So we decided to ablate the patient with the high dose, and 6 months after ablation, the ultrasonic of the same patient shows a complete resolution of the disease from the thyroid bed. Here again, a picture of a patient before ablation therapy. It's a iodine-131 scan, and it shows a significant iodine-131 avid residual in the thyroid bed. That was completely ablated by giving high dose of iodine-131 therapy, and 6 months at 6 months interval. This is the picture that shows complete resolution of disease. Here is the percentage of the disease-free patients in both the groups, the high dose and the low dose, and the intermediate and low risk patients. We can see the response at the end of 6 months, 1 year, and at the end of 2 years. Maximum number of patients who were disease-free at the end of 2 years were 86%, and these were low risk patients, and they were among the high dose group. And the 84% patients, they were normal at the end of 2 years, and these were low risk patients, and they were ablated with low dose iodine-131 therapy. These are the trend lines, basically showing the percentage of the disease-free patients at the end of 6 months, 1 year, and 2 years in both the groups. The red line for high dose, and the blue line is for the low dose group. These are the first one are the intermediate risk patients, and in the second column we see the low risk patients. The trend lines show a small, comparatively large difference between the two groups in intermediate risk patients, and the smaller difference in low risk patients. We also calculated the Spearman correlation coefficient for these patients at the end of 6 months, 1 year, and 2 years for intermediate and low risk patients, and to establish a correlation. And here we see that if you look at the values of the Spearman correlation coefficient, we can see that there exists a strong correlation between the two groups and at all the 3 intervals. These bar charts are showing the treatment outcome, that is the outcome of radioactive iodine-131 ablation in intermediate and low risk patients. The longer bars are actually showing the high dose and low dose group patients who are disease free at the end of 2 years, and the smaller bars are these are showing the patients who are disease positive at the end of 2 years. And as we have seen that there was a strong correlation between the two groups of patients who are disease free at the end of 2 years. Interestingly, the difference among the disease positive patients at the end of 2 years was again statistically insignificant in intermediate and low risk patients. So we concluded that low dose of radioactive iodine therapy is as effective as high dose iodine-131 therapy for thyroid remnant ablation in intermediate and low risk BTC patients. Maximum percentage of disease-free patients was among the low-risk patients who were ablated with high-dose radioactive iodine therapy. However, the treatment outcome that was in the form of disease-positive patients or the disease-free patients was comparable in both the groups, in both intermediate and low-risk patients. Our study results are quite relatable with the previously conducted research trials, for example, the 2 large multi-center trials and the 1 meta-analysis. The references are on the next slide. These studies, they demonstrated that the low dose of iodine-131 therapy is as effective as high dose in thyroid remnant ablation in low and intermediate risk patients. Here are the references. Thank you for your patient listening.